Downtown East comes together on International Overdose Awareness Day amid growing fears over the Ontario government's plan to close 5 supervised drug consumption sites in Toronto. Communities in the Downtown East gathered for International Overdose Awareness Day. The events highlighted the critical role these sites play in saving lives and preventing overdoses, particularly in neighborhoods hit hardest by the drug toxicity crisis. RPTV's Gabriel Meissner attended 3 commemorations where harm reduction advocates and community members came together to honor lives lost and demand action. On Saturday, August 31st, the 519, Street Health, and other partner organizations hosted a powerful Together We Can End Overdose event, emphasizing the crucial role of harm reduction in saving lives and the importance of naloxone training for community members, ensuring that everyone can respond to overdoses effectively.
We see so much every day. We have so much with our community, and we need to fight back at this point.
Hi, my name is Lynn Sally. I'm the Executive Director at Street Health Community Nursing Foundation, located at Sherbourne and Dundas. Today is International Overdose Awareness Day. It happens every year on August 31st. It's a day to remember and memorialize those we've lost, and also to discuss the very important topic of overdose prevention, and preventing overdose deaths, unfortunate as they are. It's very preventable, and so today we give meaning to that, and we celebrate the change that's been taking place, but also a very somber event to remember those we've lost. I've been working in the mental health and addiction sector for 30 years now. We've seen lots of change, and lots of changes most lately. More and more people are dying of this totally preventable deaths. In Canada, 42,000 people have lost their lives due to overdoses. That's comparable to as many lives have been lost during World War II. So it is a very serious health matter, and it needs much more attention than it's getting. So that's really what was important to me today, just being able to, speak and talk and discuss and come together as a community. That's more than anything is really important, because we've all lost friends and family and loved ones, and so that ability to connect was just really so important to me. Definitely a takeaway from today.
At the Moss Park CTS under the South Riverdale Community Health Center, attendees gathered at 134 Sherbourne Street to mark the day with similar activities, emphasizing the importance of safe spaces for drug users amidst the threat of site closures.
My name is Steph Pinch. I'm a researcher at South Riverdale Community Health Center, and I work with the Moss Park Consumption and Treatment Service.
What can you tell me about the Moss Park CTS and its removal and
So we're a healthcare service. We provide first overdose response for folks. So folks come in with a pre-obtained substance, use the substance within our consumption site, and we have trained professionals who are able to respond to any medical emergency that comes up. So that could be overdose, that could be any other kind of medical emergency that folks are having. We connect people to care. We've reversed 517 overdoses in the last fiscal year. Every month we have about 200 unique visitors, so unique individuals coming and using our service. We distribute harm reduction supplies. So we distribute sterile harm reduction supplies, which can look like needles or pipes or anything like that. And by providing those supplies, we reduce the transmission of Hep C and HIV, a healthcare practice that has been used for the last 30 years. We also provide a lot of holistic wraparound care for folks. So we help people with appointment reminders. We help people coordinate complex care. We do long-term chronic disease prevention and management for folks. We do case management. We help folks get housing. We support folks with employment applications, all that kind of stuff. So our return rate for harm reduction supplies is over 100%. So of what we give out, we get more than what we give out back. So we make sure that these discarded supplies after they're used are not in communities, they're not on streets or in parks or in alleys. By giving people a safe place where they can use their substance of choice, we also make sure that folks are not using drugs publicly and that there's somebody around to save them if they do experience an overdose.
And why is it important that we keep these and that we don't replace them with the heart or some other type of safe place for people to be that are more focused on treatment and less on just helping them and caring for them?
So we do a lot of addictions treatment on site. So we operate not as a residential treatment facility, but as a day program for a lot of folks. We're able to coordinate opioid agonist therapy treatment for folks. So a lot of our service users are on methadone, Suboxone, and have been able to access that through our nursing team. We also do detox calls for folks and try to help folks get into recovery. Last fiscal year at Moss Park, we made 55 calls to detox and we had 2 beds available. So that's less than a 4% success rate for actually getting folks into detox. So we support folks anywhere on the recovery journey and anywhere that they try to make a change, to have a healthier life, whatever that might look like for them, any positive change. But what we're seeing is that there is not capacity to meet the demand for detox and for inpatient treatment. Inpatient treatment is often a costly program. It can be $17,000 and up for a 1-month stay, and ODSP rates are around $1,000 a month if you're on ODSP. So that's really impossible for folks. We also know in the street supply right now, about 50% of the supply that was tested over the last year by the Toronto Drug Checking Service was positive for benzodiazepines. So people who are using fentanyl are actually also using benzodiazepines, giving themselves a tolerance, and that withdrawal requires medical supervision. There are only 28 medically supervised detox beds in all of Toronto for a city of 3 million people. So it's not enough. Benzo withdrawal and alcohol withdrawal are the 2 kinds of withdrawal that can kill people. We need to have medically supervised services, and this place is able to connect people to primary care, is able to provide that on-the-spot support for folks. Our model is tested, tried, and true. We've been operating out of this location since 2018, and we have the evidence behind us that shows that people are being connected to care, that shows people are better off for being connected to the service than when they arrived. So we are unsure about other models that haven't been tested, and there is no research behind that. But we know this model is working for folks.
Cool. And what is happening to this CTS?
So this consumption and treatment service is losing their location. Unfortunately, the building has, our lease is not continuing. It's going to be sold to condo development. So our landlords have been very generous and kind in extending our lease, but we know that that's not going to last forever. The new announcement by the government says that no new sites are going to be approved to be opened. So if we move because we no longer have this building, then our site will close.
And do you think that condo will be good in this neighborhood?
I think there will be a lot more deaths in this area. There will...
Sorry, say that one more time.
So if this site closes, there will be a lot more deaths in this area. We don't have to wonder what that would look like. During the pandemic, a lot of services shut down, and we had staff coming to work, finding dead bodies, responding to people in the street. We do outdoor overdoses response here as well as the inside overdose response. So that's a lot. It's a lot of public drug use that we're preventing by being open right now, and also the new government announcement indicated that we would no longer be able to distribute sterile drug use supplies, and that would mean rates of HIV and Hep C would go up.
Is there anything else you'd like to add?
Yeah, these services save lives, and I think if folks want to make sure that their communities are safe places, we are very invested in the safety of this community and making sure that we give people a safe place to go where they can connect to care and where they can connect to services and where they can be treated with dignity, humanity, and kindness.
I feel like this is a big point because a lot of people are afraid that having safe injection sites are going to bring homeless people, people struggling with addiction, to their neighborhood, when actually it's the opposite. You guys are the people who are actually taking care of these people and making the neighborhood safer.
Yeah, there has never been a drug-free society in the history of the world. People have and will always use drugs. We value the lives of people who use drugs. A lot of people I care about are people who use drugs, and if people are going to use, we want to make sure that they use in an environment where they can access sterile drug use supplies and where they can be responded to if they do have an overdose so it's not fatal. We don't have any 24-hour overdose response sites in this city. We have a lack of overdose response and harm reduction services to begin with. So this would make things a lot more difficult if this site were to close.
Okay, thank you so much, Seth.
Yeah.
Okay. My friends, I'm outside one of our safe injection sites right here in Moss Park. And I just want to let you know how important of a public service our safe injection sites are. This is where our neighbors come to get care, critical care and interventions that will make it possible for them to live. These are our neighbors, these are our family members, these are our loved ones. And I just want to send a message to all of you to make sure that you connect with your member of parliament provincially, contact MPP Christine Wong Tam, contact our federal representative and Minister Marcy Ian. Let them know that we need safe injection sites in our community. This whole plan by Premier Doug Ford to mislead the public will fail when you come to open houses and get to see with your own eyes how the safe injection sites are critical for our community. This fear-mongering that they're going to be closed down around schools will not work. We know that because they are accessible, that means there'll be less, potentially dangerous needles or other pieces of, healthcare-related materials on our streets, around our schools. So we need to do the right thing and support evidence-based solutions that make it possible.
Go back a little, evidence, sorry.
Okay. Support evidence-based solutions that make it possible for our community to access critical public health care. And this is what it is. This is where we make it possible for members of our community to live with dignity. And another important thing that you all need to know is Premier Doug Ford is actually cutting the amount of safe injection sites in our community. He's reallocating funds. He wants to name it a fancy term like Heart Hub. It's not going to work. We need safe injection sites in our communities to make sure that everyone that wants help gets help in our community. And it's our responsibility to stand with our neighbors to ensure that we don't put at risk our loved ones, our neighbors, our family members, people that we deeply care about. So please connect with your elected official and let's make our community safer by protecting safe injection sites. Thank you.
Lastly, the Thunder Woman Healing Lodge Society hosted a hot dog lunch to bring awareness to the crisis.
My name is Lexi.
Nice to meet you, Lexi.
I'm the program manager here at Thunder Woman Healing Lodge Society. We're a non-for-profit organization that supports Indigenous women coming out of incarceration and helping them reintegrate back into society in a holistic way, in a culturally appropriate way.
And what is this event that we're at today?
This is our Hot Dog Day event in honor of Overdose Awareness Day, honoring those who have lost their lives to overdose.
My name is Alicia Eckley, and my spirit name is Morningstar Woman.
Say that one more time.
Morningstar Woman? is my spirit name.
Oh, very nice.
Yeah.
And tell me, what is this event?
Well, this event is for representing and celebrating basically for people that have passed on overdose. It's an overdose awareness day. So we sit there and we hand out Narcan kits, free hot dogs for people that are hungry. And it's a good general area for that, so yeah.
And what do you think is the importance of an event like this to the community?
To the community? Well, everybody should be aware, right? Everybody should have a Narcan kit because you walk down the street and people are using all the time, and it could happen any time. And they're actually very convenient, the Narcan kits, because they bring back from an overdose. They bring back people like instantly. So it just shows the community that people care. You know. Yeah.
It's a really beautiful thing. Just
Yeah, it is.
like everybody out here coming out, getting people on hot dog or
Yeah.
giving people hot dogs.
It is.
Yeah.
Hot dogs and kits and information too, right? Everybody has some information here and about rehabs and treatment centers.
These events not only honor those we've lost, but also reaffirm the Regent Park community's collective commitment to harm reduction, ensuring that our neighborhood remains a place of support and solidarity in the face of growing challenges.
Don't forget to like, comment, share, and subscribe to our YouTube channel. And please follow our social media platforms. For more information, check out our website.